Hello, my name is Curtis Crane of Crane Center for Transgender Surgery, and I am both a board-certified plastic surgeon and a fellowship-trained reconstructive urologist. Today, I'm going to talk to you about fistula repair. A fistula, as you probably know if you're watching this video, is that it's a hole that you don't want. And there can be fistulas from organs to skin all over the place, but given the surgeries we offer, we specialize in urethro-cutaneous fistulas, which means there's a fistula from the urethra to the skin. And this just happens when two suture lines heal together. We often wait for scar tissue to build up because sometimes as scar tissue builds up, that fistula closes. That's what usually happens. It can take up to 3 months. However, if it's not healed after 3 months, it's probably not going to heal on its own. But then I prefer to wait until a patient is 5 or 6 months out before I reoperate on that tissue, because doing a fistula repair on tissue that's inflamed, trying to heal, has a lower chance of success than performing a fistula repair on non-edematous, not swollen, healed tissue. So we want to wait until we can give you the maximum chances of success. Fistulas typically don't make anyone sick. They don't cause any pain. It just creates unhygienic urination, where instead of all the urine coming out the tip, it's coming out along the shaft or the base or somewhere else that we don't want it to. So all is not lost if you need a fistula repair. It's okay. What I often say to my phalloplasty patients is, hey, look, there's a risk of getting a fistula repair, of getting a fistula, necessitating a fistula repair. If it happens, all is not lost. It's as though we just built you a Ferrari from scratch, and this is like we have to change out a tire. It's not a difficult surgery. A fistula repair usually takes me about half hour, maybe 45 minutes, versus the phalloplasty can take 7 or 8 hours. So that should show you the difference in complexity. The only downside of a fistula, well, not the only, but one of the biggest downsides of the fistula repair is it necessitates a suprapubic tube, again, for 2 weeks. Then we get it out, get you urinating on your own. That just gives that suture line some time to heal. So the process of a fistula repair is we go in, excise the skin that's grown through the hole, and then close in multiple layers. I am very fortunate to have been trained by Dr. Santucci. He was my fellowship director in trauma and reconstructive urology. So I had a year of specialized training just in stricture and fistula repair by one of the world's best. And now he's here with us at the Crane Center for Transgender Surgery. So either of us are very well trained to perform your surgery. We perform the surgery. Usually we do these on a Friday. We'll see you back in clinic Tuesday. Make sure the suprapubic tube has been draining and leave that in 2 weeks, remove it, and then that's pretty much it. Patients can return to work with a suprapubic tube in. I think most of my patients choose not to, but for a desk job or even a job with manual labor, I've seen patients work with a suprapubic tube. That said, I would rather you don't lift anything heavy for, I would say, 2 to 3 weeks. Heavy would be anything greater than 20 pounds. But if for some reason you still needed your suprapubic tube a month out, which I can't remember a situation where that ever occurred, but if you did need that, then it would be okay to go back to even a manual labor job after 3 or 4 weeks. But like I said, most of my patients just choose to take that time off of work. We're happy to write you a note so that you can not have to work with a suprapubic tube in, because as you know, or probably know, it's kind of uncomfortable. The risks of a urethral fistula repair include infection, bleeding, wound healing complications, recurrence of the fistula. I often have patients ask, what's the chances my fistula will come back? Usually for a relatively small fistula, it's about a 10% chance. 90% are successful just one time. Occasionally for a large fistula, the risk of recurrence is higher. It also depends on where the fistula is. If the fistula is kind of in a very scarred area, then typically scar tissue doesn't have the wound healing capabilities that a non-scarred area might have, and that just comes down to blood supply. That is a great overview of fistula repair. I'm happy to answer any of your questions in your preoperative consultation, and we look forward to seeing you and getting it so that you only urinate through one hole instead of multiple.